helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Tom Reiter. He is the CEO of Rocky Mountain Healthcare Services. Tom, welcome.
Good morning. Thanks for having me.
Now, Tom, Rocky Mountain Healthcare Services I know has been in our community for a long time, but if our viewers are not familiar with the organization, tell us about its history and what you do.
Sure. Rocky Mountain Healthcare Services started under a different name back in the 1970s.
Wow.
And is home and healthcare, and it was a small, unskilled home care agency.
Wow,
And
that really ahead of its time at that point, coming into people's homes and helping them?
it really was, trying to maintain people living at home and staying out of going to a nursing home.
Wow, which is a great goal, a goal for many folks.
Yeah, it really is.
And now you've grown and expanded. Tell me sort of what you look like today.
Sure. Today, we've had incredible growth over the last 3 to 5 years. We now operate 3 primary programs. One is called the Program of All-Inclusive Care for the Elderly. It's Rocky Mountain PACE, it's the acronym.
Okay.
We run brain care, which serves people with acquired brain injury or traumatic brain injury. And we do that by providing a continuum of care from residential to day treatment programs that help people recover from their brain injury and reintegrate to live as independently as possible.
Okay.
And then we provide a transportation resource called Health Ride, which not only serves our PACE program, and our brain care program, but also individuals in the community through some separate contracts that we have.
So a wide range. Let's tap into a few of these. So the
Sure.
PACE program, that's designed to help folks who want to remain in their home, but they might have needs that might require nursing home type care.
Sure, to qualify for the program, people have to be 55 years of age or older.
Okay.
They have to qualify for nursing home level of care under the state guidelines. So
Gotcha.
that's a tough thing to get your head around. Do I belong in a nursing home or don't I? And then they have to qualify for Medicaid or have the resources to pay us privately.
Gotcha. Okay. And so, but that's a great resource for people, a unique resource in this community, so people can really remain in their home if that's what they choose.
It is. People want to age in place.
Sure.
and live as independently as possible. Their home's a comfortable, familiar environment. Our program, through the integration of all the different resources and services, allows them to stay at home for as long as possible.
Got it. And then the brain injury program, that's really for any adult in the community, 18 or older.
18 and older, yes, that has experienced traumatic brain injury or an acquired brain injury, such as a stroke or a drug overdose, who are trying to rebuild the skills that they need to live independently.
And that day treatment service is a great idea there. And then the transportation department, what a great idea, because I know that that's a barrier for some folks if they can't drive anymore.
It is. In the PACE program, it's a requirement that we provide or contract for transportation, and we choose to do it internally because of all the nuances that go on in transporting people.
Sure.
Taking them to and from their doctor's office, to and from our adult day health center, and it really is a make or break for people getting the care they need or the resources they need, because if they don't have a ride, they get stuck, and then
that's difficult. So how do we get started? What's the evaluation process like? If I call up and say, I think I might need some help, what happens?
Sure. For either program, PACE or brain care, if people call us, we'll send somebody out to sit down with them and explain what we do, how we do it, how people qualify for the program, because people don't always know where to turn when they're starting to have issues as they get older in life.
Sure. And you'll create a plan then, that's the idea.
We do. One of the unique features of both brain care and PACE is that we have a fully integrated interdisciplinary team that comes together to look at the unique needs of the individual and partner with them to put together a care plan as far as their healthcare services, their home care services, whatever they need or whatever the barriers are preventing them from being able to live independently and stay at home.
So the point is, don't hesitate. If you think this applies to you or a loved one in your family, pick up the phone today and just get started.
Absolutely. People don't know where to go, where to turn, and we're a resource for the community. Whether people are our program's a right fit for them or they feel comfortable with our program.
But the help is there.
The help is there.
Great. Thanks so much, Tom.
Sure.
Thanks for joining me today, and every day I'm your host, Jen Lennon.